Welcome to Health Matters, a show about what matters to your health here in central Massachusetts. My name is Jay Broadhurst. I'm a family doctor here in Worcester, and I'm proud that this is a collaboration effort, our show between the Worcester District Medical Society and WCCA TV, the People's Channel, number 194 on your cable dial. This show is one that is close to, I think, all of our hearts, because it has to do with the safety and well-being of our community in a way that is a really hot-button topic, and it has to do with gun violence. I'm joined this evening by my wonderful friend and colleague, Dr. Peter McConarty. Dr. McConarty is a family doctor as well. He is someone who's been part of the Massachusetts scene for a very long time. And I first came to know Peter probably 30 years ago or so, when he was working at the Family Health Center of Worcester, at that time on Main Street, South Main Street. He has since been up in Fitchburg and has been teaching medical students and residents both here in Worcester and in Fitchburg. And frankly, Peter, I've always thought you were a wonderful family doctor, and you know, we're a full spectrum kind of guy in the sense you took care of moms who were pregnant, you were there for the delivery of the newborn, you took care of that infant and toddler and up through the school age years and that rough teenage time and young adulthood and adulthood, and then people tend to get into the phase of their lives that frankly you and I are in, which tends to be, I'm always distressed about the COVID business and how I'm elderly, but I guess that's what I am. But here we are talking about gun violence, and I was hoping you'd share with our listeners how it came to be that you have, and it may be that this has always been an interest of yours, but I'm delighted that you're here to highlight it tonight, and I wonder if you'd be willing to share how you came to be interested in gun violence.
Absolutely. Well, I went to San Francisco for residency
right.
in 1973. Yeah, I graduated in 76. And in 1983, I was working at a community health center on Potrero Hill, the Potrero Hill section in Worcester. And
It's in San Francisco.
right? in San Francisco,
okay,
right?
Right.
Yeah, I'm sorry. And a 76-year-old man came in and said he had chest pain and needed to see a doctor emergently. They put him in a room with my partner, Bob Ross, and he shot him dead. And he did that right outside my door in the nurse's station. So I was curious what was going on. I thought it was firecrackers, to tell you the truth. And so I went to the door and saw this guy with a gun, and he shot me. And to make a long story short, before I ran past him while he reloaded, he shot me 5 times. And he murdered my colleague. And so, yeah, I kind of have a personal interest in gun violence. I experienced the trauma not only of that moment, but what I suppose was PTSD.
Sure.
Went on for 3 or 4 years before I got control of that. The trauma to my family, the trauma to the community, the trauma to everybody that was working in the health center that day.
Right.
And but as a matter of public health,
Right.
Gun violence is up there as a cause of death and mayhem in the United States. That is, well, I just saw something on Spectrum TV this afternoon that said that the second most common way that a person will die between the ages of 12 and 26 is with a gun.
Is that right?
And that's what it must be true. It's on
Well,
Spectrum News.
right, but I think that has been something that sort of flies under the radar, because when people talk about, well, why do people die? You know, it's cancer, it's heart disease, it's smoking, those are all important public health issues. But to make that adjustment and see gun violence, not, you haven't said anything about a criminal justice, was this person thrown in jail, whatever. That's not what we're talking about here. It's that we can see gun violence as a public health emergency.
Well, as family doctors,
yeah,
we spent, a long time with people who had diseases.
Yeah, right.
We did as much preventive and anticipatory care as we could.
Yeah.
But we were not involved in the public health. We were supposedly part of the solution of improving the public health.
Right.
But we were doing it on an individual basis.
Right. Patient by patient.
Patient by patient. Sometimes.
Families.
Some families. Sometimes reaching out to the community to do work about conditions in a certain section of the city.
Right. Or teenage pregnancy.
And I know that you've been involved in addressing another huge public health problem, opiate addiction.
Right.
And I heard that there were 26 narcotic overdoses this past weekend in Worcester.
Is that right? I didn't know that data, but
I didn't
I
know
do
it
know
either,
that on spring break, just in Fort Lauderdale, there were several folks who wound up being in the hospital. The ones that got the news were the people from the U.S. Military Academy who were on their spring break. So, opiate dependence is an equal opportunity disease. No question about it.
And as family doctors, we, in addressing addiction,
Yeah.
when a patient had a problem with dependence on narcotics,
Yep.
Clearly we understood that affected that person's risk, all sorts of risks of soft tissue infections, risk of infection of heart valves,
Right.
Abscesses in the brain and the liver.
Yep.
But there was also the issue of them overdosing. And then there was also the issue that their problem was having a huge impact on their families.
Yes.
And as such, it was having a big impact on the community.
Right.
And as family doctors, most oftentimes we focused on taking care of the person in front of us.
Yeah.
But there was also this other possibility that addressing the issue from a public health point of view. And addressing gun violence
Right.
is not really about taking care of patients, because the people become patients after they get shot,
Right.
which is too late. It's like taking care of people after they die of a heroin overdose.
Yeah.
Well, you bury them.
Right.
That's it.
Right.
But from the point of view of family doctors, it's taking another step to say, this is a public health problem and I'm going to get involved in it.
Right.
And as it turns out, opiate addiction is the #1 killer, other than COVID.
Of that group that you were just mentioning.
The most common way that a person between the ages of 18 and 35 dies in the United States is not COVID.
Yeah.
It's narcotic overdose.
I see.
And so from a public health perspective, gun violence is a different kind of challenge. There's very little that you and I could do on an individual basis with a patient and a family in the room to address the issue of gun violence. There are things that we could do, and that's one of the reasons that I am a co-leader of Moms Demand Action for Gun Sense in America.
Ah,
Yeah, there you go.
there it is.
That's me.
Moms Demand Action for Gun Sense in America. Is that
Yes.
right? All right.
And I am the Central Massachusetts co-leader, along with Joanna McGugan, to bring this up as a public health issue and address it. So there are a number of things that we do as public health advocates. One of which is to use the bully pulpit of being a family doctor.
Yep.
Some people think that that's pretty important, and they listen to us as if we know more than they do. But sometimes I wonder.
Right.
But there's also the issue of, for instance, public education.
Right.
If you're going to address a public health issue, you address it through bringing the issue up and discussing it publicly so that people say, oh, yes, I understand that.
Right.
That's what happened with seatbelts
Exactly. Right.
in cars.
Right.
The automobile industry did not want to put seatbelts in cars. It was going to raise the price too much.
Yeah.
I don't know when that happened, when 1965 or something like that.
Unsafe at any speed.
And
Right.
left to their own accord, the government would have gone along with the automobile makers, and they would have said, no, we can't force them to put seatbelts in cars. But there was a huge public health effort to educate the American public, so the American public said, oh, of course we want to reduce the harm
Right.
of automobile accidents. And how can we do that?
Right.
Well, stricter rules about driving while under the influence of alcohol
Right.
was part of that public health issue.
Right.
Another was seatbelts.
Right.
Another was infant car seats.
Right.
There are many examples of successful efforts in the United States about improving the public health through public education and legislation.
Increasing awareness. A couple of others I just thought of as you were talking, sudden infant death syndrome, where, what are the safest way to have a baby go to sleep?
Yeah.
And I'm a sports medicine guy, and, in Little League, when kids were twisting their ankles all the time, gee whiz, if we make the bases breakaway with Velcro, then they're not going to twist or break their ankles sliding into second, kind of stuff, So
Yeah.
I understand. How does that work with gun violence? I mean, what is it that we don't know that we should?
Well, one thing that the public perhaps does not know is that there's an organization, there you go again, Moms
Right.
Demand Action, for gun sense in America. That there is a national organization that was founded after the Sandy Hook massacre. It's called Everytown USA.
Right.
And the grassroots wing of Everytown USA is Moms Demand Action.
Okay.
We have chapters in every state in the union. We have a very active chapter in Massachusetts, and an increasingly active subchapter in central
In the
Massachusetts.
Central Mass area.
So awareness that there's an organization out there that is saying, we're sick and tired of the number of our fellow citizens who are being injured with firearms.
I see. Uh-huh.
6 people killed in Worcester in the last 18 months.
Wow.
That's not a lot when you think about Dorchester, but it's a lot. It's a lot of people.
Yeah,
and it's completely preventable. what do people need, what might people be interested in
Right.
about gun violence? Well, the United States is far and away the worst country in the developed world to live if the measure is what's your likelihood of dying of gun violence.
I see.
Massachusetts has among the strictest laws regulating firearms, and coincidentally, the lowest homicide rate by firearm. We'll get to the legislation issue in a bit.
Okay.
But Massachusetts, says, well, we have a low firearm homicide rate. Well, that's true compared to every other state in the United States.
Right.
But for 7 million people in Massachusetts,
Right.
we have many more homicides by firearm than all of Great Britain, which has 70 million.
Isn't that something?
They have 10 times as many people, and many fewer people are getting killed with firearms.
Right.
So there's a lot of room for improvement
It sounds like
in Massachusetts.
Let me just take a minute and remind our viewers that you're watching Health Matters. I am James Broadhurst. I'm joined for this show by my colleague, Dr. Peter McConarty, who is a family physician, who is a co-leader of Moms Demand Action for Gun Sense in America. And we're talking about gun violence as a public health matter and how it is that we can move from where we are to being in a safer community where the likelihood of dying from gun violence or being injured by gun violence can be decreased significantly. And so while we're doing well, according to the measure of other states in the United States, you compare us to Great Britain, and the injury rate, the homicide rate here is far and away greater than it is there.
It is baffling to Europeans that we put up with this.
Right.
It is absolutely baffling. I lived in Spain for a number of months, and several times people ask me, "What's with the guns?"
Yeah.
They just don't understand. Of course, my response to that was, "Well, what's with the bulls?" But
Exactly.
but it's a deeply ingrained cultural phenomenon.
So
The Spanish love their bullfights.
they do, and we love our guns.
Americans love their guns.
Right. So you've mentioned on the public health perspective that first identifying a problem and shining a bright light on it so that we gain a better understanding of it. When I think about public health, the other thing I think about immediately is prevention. What is it that we could do to prevent deaths from COVID or ankle injuries on the Little League diamond? What about gun violence? Where can we work to try to move the needle on prevention?
This brings up the issue that moms. It does not say moms demand action to outlaw guns.
No.
It says for gun sense. Because in the United States, the Constitution says in the Second Amendment
Right.
that people have the right to own a firearm.
Right.
Now, it is the fact that in Europe, nobody has the right to own a firearm. So people don't own firearms, and therefore they don't kill and maim each other nearly as often as we do. But we're not in Europe.
No, we're not.
We're here.
Right.
And we have to deal with the fact that it is a constitutional right to own a firearm.
Right.
It is not a constitutional right to use a firearm to injure your neighbors, your family, or someone at the bank.
Right.
So Moms very explicitly is not against the Second Amendment. Moms very explicitly says, we're not in this to take anybody's guns away. Responsible gun owners
Right.
have the right in the United States.
Right.
to have a gun. Irresponsible people shouldn't have guns.
Right.
People who have a record of violent behavior probably shouldn't have a gun.
Right.
There probably ought to be some limit on what kind of guns people can have in the United States.
Right.
You can have a gun, but you can't have an anti-tank weapon,
Right.
right?
Right.
Or a military-grade weapon that is, it's very controversial. In the United States, we had a ban on semi-automatic military-grade firearms for a period of about 10 years.
And then I guess it expired, is that?
Yeah,
right?
it was said, that this was to be in effect until 1998 or something, and then it had to be renewed. And when it came up for renewal, it was not renewed. So you can own an AR-15
Right.
in the United States. Now, some people would say, well, what do you need an AR-15 for? Well, I'm not going to go into that.
Sure.
But if you've got a history of violent behavior, if you've got a history of being involved in drug crimes, if you've done time, been convicted of things that the society has said that's not okay.
Right.
You can't live in this society and behave like that. Then maybe that person shouldn't have access to firearms.
Right.
So, legislating about who can own firearms and under what circumstances they can own firearms is not about taking guns away from anybody and taking away their Second Amendment rights.
Right.
It's about regulating it in the same way that we regulated automobiles and said, you have to have seatbelts in there.
Right.
Did it say we can arrest you if you don't use the seatbelt? Well, you can get a ticket.
Right.
But
Right.
it was the public health issue was people die in automobile accidents. Fewer of them will die if they use seatbelts, and we're going to mandate
Right.
that the manufacturers have to put the seatbelts in there, and we're going to encourage everybody to use them.
Right. Yeah.
So MOMS is not anti-Second Amendment. MOMS is for gun sense. Doing better to reduce the harm.
Right.
Unfortunately, we're not going to reduce the murder rate in central Massachusetts to 0 as long as we've got this many guns around.
Right.
But maybe we can reduce it by half. That would be a start.
I was going to say, then you've got half the people still alive.
And that's about this concept, Jay, of harm reduction.
Yep.
What's the saying? Don't let the perfect be the enemy of the good.
Yeah.
Right?
Yep.
Massachusetts has reasonably strict gun laws by U.S. standards and a low homicide rate
Right.
with firearms. We have reduced the harm.
Right.
Can we reduce it further?
Right.
Well, to some extent, that's about educating the public about how big is the problem?
Right.
What possible solutions would there be? And working to educate the public, but also legislation. For instance, 2 years ago, we advocated very strongly in Boston for a extreme risk protection order,
Okay.
which you can think about this as if someone's involved in a domestic violence situation,
Right.
the person who's being harmed
Right.
can go to the court and say, I need protection from this person.
Right.
And you can get a protection order.
Right.
And
A
say
restraining order, whatever.
A restraining order.
Right.
And that person then is told, you can't come within,
Some distance of that person.
yeah.
Right.
And the extreme risk protection order was is the same sort of thing, but it applies to firearms. So if someone is in a house where there are firearms, and there is someone who is behaving erratically or is threatening to be violent, either to people around them or with suicide,
Right.
we passed ERPO, Extreme Risk Protection Order,
Right.
and that says that if someone wants to protection in the face of guns in their house,
Right.
they can go to the police chief and say, this is too dangerous.
Right.
And that goes to the court, and the judge then makes a judgment. And if he says, yeah, it sounds like this is a pretty dangerous situation, we're going to take the guns out of that house.
For some period of time.
For 7 days
Right.
before someone has a hearing and try to convince the judge that no, that's all made up, and they can get their guns back.
So this was actually put in place.
There's
Is that
actually,
correct?
it was voted in place, a very important thing.
So we are now coming toward the end of the show, and I want to make sure.
Already?
I know, time flies when you're having fun. And I wondered if there are any final things that you wanted to mention about gun violence as a public health matter.
Well, several, but we don't have time.
Right.
So you have to invite me back.
Okay, that's fair enough.
Right now in the legislature, there are two things
Yeah,
that are being debated.
yeah,
One is that in 2014, they said, we're going to collect all the...
you're going to just have to list them because we're running out of
Okay.
time.
And the second is ghost guns.
Ghost guns.
Ghost
You're right,
guns.
we ought to have another conversation about
Yeah.
that. That's a big,
Yeah,
that's
because,
important
because,
piece.
you can go on the internet this afternoon and buy a kit for $500 or $600
And have
and
an
build your
untraceable
own,
gun.
build your own Glock pistol.
I know. Well, I am so sorry that we don't have more time to be able to review the newest topic of ghost guns. My name is James Broadhurst. I'd like to thank you for watching this show on gun violence with my colleague, Dr. Peter McConarty. I'd like to thank Frank Rocco, our engineer, for putting this show technically together, and Melissa Boucher, the coordinator from the Worcester District Medical Society. Again, my name is James Broadhurst. Thank you so much for watching.